There is a healthcare crisis in Pennsylvania. Not enough doctors, long hours spent in waiting rooms, shorter visits. Not to mention the cost of going to a doctor, even if you have insurance. But for some mobility health problems, a solution that already exists, but few people know about. Channel 4X News anchor Sally Wiggins here with a story about direct access.
It's amazing how many people don't know about this, you guys. So listen up. We're talking about something called direct access to physical therapy, an option that has existed for consumers since 2004. What it means is that you can go directly to a physical therapist without a doctor's referral, and in most cases, your insurance will pay for it. Shoulders, ankles, backs, necks, and knees. We need them to move, but sometimes that movement is impaired.
She's too young to have a total knee replacement, so basically we're trying to keep her going as long as we can in keeping her active and fit.
Mary Lee Beach is a doctor of physical therapy and a partner in a practice in Oakmont. Her patient, Cindy Feldman, had knee surgery a year ago, but tennis caused a flare-up recently. So she's taking advantage of direct access.
It was frustrating to wait for an appointment for a physician, wait to see a physician, pay that money, right? Pay that copay, knowing you were going to end up here anyway.
Now, when someone in her family has a sports-related injury, the physical therapist is the first call. Recently, her son was hit by a puck while playing hockey.
And Mary Lee looked at his foot and said, you know what, you need to go for an x-ray. And sure enough, it was broke. So we did end up at the physician. He ended up in a boot.
UPMC and Penguins orthopedic surgeon Chip Burt says it's a bit of a reverse of the system in which the patients were channeled through the doctor first.
It's allowed some of the patients with just overuse injuries to go and be seen and get started on their treatment. And our therapists are very qualified, and if they suspect that there's anything that they cannot treat, then they work to send the patients to us.
Pennsylvania took a long time to get to this place. In 2002, it was the 44th state to legalize direct access to physical therapy. And it took 2 more years for the state board to come up with regulations to govern it. The physical therapist must have 2 years' experience, a direct access certificate, adequate liability coverage, continuing education, and a 30-day treatment limit for one condition before a physician is